Welcome back, everyone, to the Evidence-Based Hair Podcast. I'm dermatologist and hair loss specialist Dr. Jeff Donovan. I'm also the director of the Donovan Hair Academy. The Academy educates the public about hair loss, and we have training programs for hair loss practitioners as well. Hair loss affects all people around the world, and so we welcome all people to our programs. The Donovan Hair Academy runs the EBHF, or the Evidence-Based Hair Fellowship. The EBHF is the world's most comprehensive training program for hair loss specialists. Our EBHF graduates ultimately complete 2 years of very intensive training and are some of the best trained specialists in the world. The podcast that you're listening to right now is the official podcast of the Donovan Hair Academy. In this podcast, I review studies that are changing how we think about hair loss. I'll introduce them to you, help you make sense of them, and give you my thoughts on how a given study just might change how we diagnose or treat hair loss. And as a reminder, the podcast is for educational purposes and shouldn't be considered a substitute for medical advice. I very much enjoy offering the Evidence-Based Hair Podcast. I enjoy being able to join you for our public webinars throughout the year and our ever-popular Question of the Week program. But before we begin today's podcast, I'd like to add that your support really makes a difference. And I thank all those who have supported us over the years. We have some very big goals for the next 10 and 20 years, not only in our podcasts and our webinars and our Question of the Week program and our training programs for healthcare practitioners, but in our multiple tireless efforts to ensure that the principles of evidence-based medicine will always be our guide in this most perplexing and complicated world of hair loss. If you'd like to learn more about our programs and projects that we're currently fundraising for, or to make a donation, please visit the Donovan Hair Academy at donovanhairacademy.com/projects. And now on to our podcast. Today I'd like to review an interesting study from Jadcase Reports titled Use of Difenciprone for Alopecia areata Treatment During Pregnancy. Difenciprone, squaric acid, these are treatments that are not used that often anymore, but are very valuable. And certainly I offer DPCP treatment in our clinic and continue to offer this for a number of years. It's a treatment that is certainly well known to hair loss specialists, has been studied for over 25 or 30 years. And it is not an immunosuppressant-based therapy, but rather a treatment that is applied to the scalp and creates allergic contact dermatitis. And by virtue of creating an allergy on the scalp, can help patients with alopecia areata grow back hair in a certain proportion of patients. In patients with advanced alopecia areata, it is what I consider a second-line option. Options like the JAK inhibitors, methotrexate, short courses of steroids would certainly be considered first-line agents. But in patients that don't tolerate those or patients that cannot use those, then difenciprone and squaric acid become very good options. And we use DPCP for children, we use DPCP for adults. And for the most part, DPCP, or difenciprone, and squaric acid are very similar. This is a treatment where first a dose of DPCP is applied to the scalp, usually in a coin-shaped area. Some people will apply the first application to the arm. And the purpose of that first application is to wake up the immune system to recognize that, hey, an allergic compound has been applied to the scalp. And then 2 weeks later, the patient comes back and a very low dose, 0.001%, is applied to the scalp. And then the next week, the patient comes back, and if they've had no reaction, a higher dose is applied. And they come back a week later, and a higher dose is applied. And they keep going up on the dose until they get a dermatitis or an eczema. And once they get a dermatitis, they stay on that dose. So this is a topical treatment which creates an allergic reaction on the scalp purposely. And so DPCP has been studied for almost 3 decades now. And the purpose of this study in JADCASE reports was to outline a patient that used DPCP in pregnancy. The reason this is such an interesting study is because DPCP is generally contraindicated in pregnancy. We don't have a lot of good data about the use of DPCP in pregnancy. There have been some women in the world that have become pregnant on DPCP and have had healthy pregnancies, but the data is limited to a very small number of patients. But what's interesting is the outcomes so far have been pretty good. And this report by Desai and colleagues in JADCASE reports formally outlines a patient using DPCP during her pregnancies. So she stopped DPCP in her first pregnancy, and she developed hair loss after delivery. And this was a significant amount of hair loss that she experienced. Now, in order to reduce the chances of severe hair loss in subsequent pregnancies, the patient stated to her practitioners that she wanted to continue DPCP in her subsequent pregnancies. And so she used DPCP, 2% monthly, during her second and third pregnancies. And the authors in this report make it very clear that this was not the recommendation. This was the patient's wish. And so she started treatment at month 4 in her second pregnancy and used it during the entire duration of her third pregnancy. And on account of using DPCP in pregnancy, she lost much less hair than her first pregnancy. And what was so interesting about this report is there was no documented complications to her pregnancy or her vaginal deliveries. There were no teratogenic effects or anomalies in her babies. And I think this is a really important study. We need studies like this. These are studies that really change the field. And it's challenging to base recommendations on an N of 1 study. But this study adds to other studies suggesting that, we do not have a lot of great data suggesting that women that use DPCP in pregnancy have harmful outcomes. Clearly, we need more studies, and clearly the recommendation is not to use DPCP in pregnancy. I'll remind you about a study in 2012 by Berth Jones and colleagues. This is a study titled Diphencyprone is not detectable in serum or urine following topical application. That was a really important study, which suggests that DPCP doesn't get into the bloodstream. And so it's unlikely that women applying DPCP during pregnancy will have the DPCP reach the baby. But that's, of course, speculative, and we need more studies. I don't think we're quite ready to make the broad recommendation about the use of DPCP in pregnancy as a routine thing, but this case report is certainly very valuable and documents yet another patient with a good outcome in a mother using DPCP during pregnancy. And I think we'll have more studies like this that will ultimately allow us to make more formal recommendations in the years to come. And I thank the authors for this very important study. Next week, we're back talking about the trichoscopy of alopecia neoplastica from breast cancer. A very interesting study of the trichoscopy of metastatic breast cancer to the scalp, and some very important lessons that we can learn about the trichoscopy of the metastatic breast cancer. So I'll look forward to seeing you for that particular episode of the Evidence-Based Hair Podcast. Thank you so much for joining me for today's podcast. It's my belief that education and educational endeavors like this podcast can help clinicians acquire new knowledge, which can ultimately help patients. And education can also help hair loss researchers to ask better research questions. And better research questions can give clear answers about how to best diagnose or how to best treat hair loss. And ultimately, this will see benefit in our patients with hair loss. And education can also empower patients to acquire new knowledge so they can engage in critical discussions with their hair loss practitioners which hopefully will lead to improved care. At the Academy, we're really proud to be able to offer educational programs for clinicians, as well as educational programs for the public. And if you're a practitioner interested in studying hair loss at an advanced level, you might consider applying to the Evidence-Based Hair Fellowship, or EBHF. This is an intense program, but it's a program that equips you with the necessary skills to really help patients. Our next iteration starts January 2026, and we'd love to have you in the program. You can learn more about the EBHF by contacting our administrators at info@donovanhairacademy.com. That's it for this week. I look forward to seeing you next week for another episode of the Evidence-Based Hair Podcast. Thanks so much.